Imagine this. Your patient can't tell you what's wrong. Their only symptom? They just walk in these endless, agonizing circles. Today, we're going to step into the operating room to solve a really bizarre medical mystery that involves a surgeon, a parasite, and one very, very sick goat. So that's the big question, right? This was the single, urgent puzzle facing a team of veterinarians. And the answer, well, it would take them deep inside the brain of their patient, where they'd find an intruder with a truly shocking secret.
Okay, let's dive right into this. Our story kicks off at a veterinary teaching hospital in Bangladesh. A farmer shows up with a goat that's suffering from something so strange, it actually has its own name, circling disease. So let's meet our patient. She's a 1.5-year-old female black Bengal goat. The case report tells us she was brought to the hospital weighing just 10 kilograms, and her behavior was getting more and more alarming every single day.
And the symptoms? Man, they were really worrying. She had stopped eating, she was bleeding erratically, and she just could not stop walking in circles. But the weirdest clue of all was the soft spot on her skull, right near her left horn. It was almost like the bone itself was just giving way to something growing underneath.
So now, the veterinary team basically has to become detectives. They've got this list of really bizarre symptoms, and they have to piece all the clues together to figure out the culprit that's hiding inside this goat's head. You know, just like any good detective, they started by ruling things out. Was it a head injury? Nope, no external wounds. Could it be some kind of poisoning? Nah, the symptoms just didn't line up. Metabolic problems? Unlikely. But that combination, the neurological signs, the circling, and that soft spot on her skull, that pointed towards a very specific and honestly a pretty sinister possibility, a parasitic cyst growing inside her brain.
So, with all the evidence pointing in one direction, the team made their final diagnosis. The cause wasn't an injury or some typical disease. They believed a living thing, a parasite, had set up camp inside the goat's brain and was slowly destroying tissue, and they knew they'd have to go in to prove it.
And this is where the story gets really wild. The culprit has a name, Taenia multiceps, and its method for survival is like something straight out of a science fiction movie, involving multiple animals in this complex, hidden cycle. The official name for this condition is Koyanorosis cerebralis, but it's more commonly called GID disease or, you guessed it, circling disease. And it's caused when the larval stage of this tapeworm forms a big, fluid-filled sac, a cyst, right inside the brain of an animal like a goat or a sheep.
Okay, so this parasite's life cycle is it's brilliant and also totally terrifying. It all kicks off with an adult tapeworm living harmlessly in a dog's intestine. The dog passes these microscopic eggs in its feces out onto a field. Our poor, unsuspecting goat comes along and eats the contaminated grass, swallowing the eggs. Inside the goat, the larvae hatch. They migrate all the way to the brain, and that's where they form that destructive cyst. And the cycle only completes if another dog were to eat the brain of that infected goat. It's an incredible survival strategy.
So, they've identified the invader, and the diagnosis is clear. But, well, so is the solution. A risky, high-stakes brain surgery. It was literally the only chance to save this goat's life.
The team gets to work, prepping the goat for surgery. The whole area is shaved and sterilized. To handle the pain, they inject a powerful local anesthetic to completely block the nerves around the surgical site. Everything had to be absolutely precise.
All right, next up, the surgeon makes a clean, linear incision right through the skin, directly over that softened part of the skull. This carefully exposes the damaged bone, bringing them one step closer to the parasitic cyst growing just beneath it. And the surgical skill here, it's just incredible. Instead of removing a large piece of the skull, which would be super traumatic, the surgeon creates this tiny V-shaped opening in the bone. This technique minimizes all the damage while creating just enough of a window to get in there and remove the invader. And this right here, this is the moment of truth, described in the cool clinical language of the case report. Using this super delicate instrument, a mosquito artery forceps, the surgeon reaches through that small opening in the skull, carefully grasps the cysts and pulls them out, finally freeing the brain from all that pressure. Okay, so the cysts are out, the surgery is a success, but the goat's incredible story, it actually teaches us a much larger lesson about not just recovery, but also prevention.
12. Just 12 days. That's how long it took for this goat to make a complete, full recovery. Think about that. After a parasite invaded her brain, after delicate brain surgery,
She was back to normal in less than 2 weeks. I mean, that is just a remarkable outcome.
But look, the surgery was only half the battle. Success really depended on diligent post-operative care. She was given antibiotics to prevent infection and analgesics for the pain. Her owner was instructed to apply an antiseptic dressing twice a day and just monitor her really closely. Then, on day 12, the sutures came out, marking the end of her whole ordeal.
So when you step back, you realize that this one single dramatic case is actually revealing a hidden ecological story. The goat sickness wasn't some random, isolated event. It was a direct result of the interaction between livestock and dogs that were sharing the exact same environment.
And understanding that connection, that is the real key to prevention. We can actually break the parasite's life cycle by preventing stray dogs from getting to grazing pastures, by implementing regular deworming programs for the dogs, and by educating farmers. So the solution isn't just surgery, it's smart, preventative ecosystem management.
Ultimately, the story of this circling goat is so much more than just a medical marvel. It forces us to ask a bigger question. It shows us how the health of a single animal is often a window into this complex, invisible web of connections that links every creature in an ecosystem. It makes you wonder, what other hidden stories are out there just waiting to be told?